First line drugs for the treatment of tuberculosis include option A rifampicin, option B isoniazid, option C ethambutol, option D all of these. Answer is option D all of these. The high mortality rate associated with Wales disease typically is the result of option A meningitis, option B jaundice, option C pyrexia, option D cardiac failure. Answer is option B jaundice. By what means do humans usually acquire leptospirosis? Option A tick bite, option B ingestion of contaminated food, option C contact with animal urine, option D shared eating utensils. Answer is option C contact with animal urine. Recurrent bacteremia in relapsing fever apparently is due to option A instability of bacterial antigens resulting in antigenic shift, option B failure of the bacteria to induce antibody formation, option C immunologic selection of different subpopulation of bacteria, option D lack of bacterial antibiotics. Answer is option A instability of bacterial antigens resulting in antigenic shift. The Clostridium species that has been associated with gangrene in humans include option A Clostridium difficile, option B Clostridium chauvi, option C Clostridium tetani, option D Clostridium septicum. Answer is option D Clostridium septicum. Serologic diagnosis is an important tool in infectious disease treatment because option A it is a reflection of current infection, option B it detects the presence of specific antigen, option C it is useful even if the etiologic agent is difficult or impossible to isolate, option D it is effective earlier in infection than any type of direct culture might be. Answer is option C. It is useful even if the etiologic agent is difficult or impossible to isolate. Bipolar staining is shown by which of the following bacteria? Option A Vibrio parahemolyticus, option B Echinella corrodens, option C Yersinia enterocolytica, option D Brucella abortus. Answer is option A Vibrio parahemolyticus. Gelatin liquefaction provides evidence of option A saccharolytic enzymes, option B proteolytic enzymes, option C peroxidase activity, option D hemolytic activity. Answer is option B proteolytic enzymes. Darting motility is characterized by the following bacteria except option A Vibrio, option B Pseudomonas, option C Campylobacter, option D Pasteurella. Answer is option D Pasteurella. Pavlovsky medium is used for the cultivation of option A Borrelia, option B Bordetella, option C Mycobacteria, option D Mycoplasma. Answer is option C Mycobacteria. The alkylating agent used as a disinfectant is option A glutaraldehyde, option B phenol, option C silver nitrate, option D hypochlorite. Answer is option A glutaraldehyde. Sterilization of heat labile substance by which of the following? Option A moist heat, option B filtration, option C radiation, option D pasteurization. Answer is option B filtration. The single most important laboratory test for determining the virulence of Staphylococci is option A mannitol fermentation, option B detection of coagulase, option C the catalase test, option D hemolysis of sheep erythrocytes. Answer is option B detection of coagulase. Laboratory test result used to identify Streptococcus pyogenes with more than 90% confidence include all except option A beta hemolysis on blood agar, option B gram-positive cocci in chains, option C susceptibility to bacitracin, option D positive bile esculin test. Answer is option D positive bile esculin test. Efficacy of a disinfectant can be tested by the following test except option A in use, option B Riedel Walker, option C Kelsey Sykes, option D Roizen Haynes. Answer is option D, Rosenhains. The best means of diagnosing bacteremia is option A, agar stab culture, option B, gram stain, option C, serial blood culture, option D, complement fixation. Answer is option C, serial blood culture. Father of modern bacteriology. Option A, Louis Pasteur, option B, Paul Ehrlich, option C, Robert Koch, option D, Elie Metcalfe. Answer is option C, Robert Koch. Which of the following organisms do not follow Koch postulates? Option A, Hansen's bacillus, option B, Parvobacterium, option C, Cardiobacterium, option D, Branhamella. Answer is option A, Hansen's bacillus. Who invented phase contrast microscope? Option A, Antony van Leeuwenhoek, option B, Ruska, option C, Landsteiner, option D, F. Zernike. Answer is option D, F. Zernike. An example of gram variable bacterium. Option A, Francisella, option B, Branhamella, option C, Gardnerella, option D, Pasteurella. Answer is option C, Gardnerella.